Hi, my name is JR, and I was a coma patient.
Good morning, good afternoon, and good evening. Welcome to the fifth and final episode of Shared Stories of Medicine for our first introductory season. This episode's really exciting because I've had clinicians and different specialists on for the first four episodes, and they got to describe what it is they do, how it is they got there. But for this episode, I think it's important not just for non-medical personnel, but the clinicians themselves to hear the perspectives that patients have, because sometimes, a doctor, a nurse, whoever, paramedic goes through their entire lives without having to be in their shoes. So sometimes it can be insightful and useful to gain somebody's perspective who just really doesn't know about medicine and has limited experience, or, their only experience is them being a patient. So I think that's interesting. Thanks for coming on, JR. I appreciate you being here.
Thank you for having me.
Yeah. So usually I always have people introduce, themselves and where they're from. So if you just want to tell people what you do for a living, where you live, etc.
Certainly. I'm 27 years old. I live in New Jersey. I've been a hospitality manager for the past 5 years. Lover of movies, nothing. It's funny, like all my life, I sort of think I haven't had anything medically exciting happen to me. And then every so often, I remember the big thing that I'm here for.
Yeah, for sure. I mean, how could you forget that, right? You and your parents, I'm sure, went through a lot, both during and after the coma that you described in your introduction. But I know you also had, some other encounters and experiences. So you want to share? Go ahead and detail your encounters with medicine.
Really, a lot of it is when I was much younger. A lot of that is going to be from the perspective of my parents. I spoke with them. It's funny, I've really never even asked them about a lot of the details that I feel like I should know about in this huge thing that happened in my life.
Yeah, seriously.
But yeah, the phone call with them was really enlightening and getting both their perspectives on, oh, no, you were here for that. No, you definitely weren't here for that. But yeah, between the coma, I was prescribed with ADHD, I believe. I was probably in first grade. So that was a big defining part of like my childhood.
Sure.
It was all the way from first grade until, I'm going to say, I probably stopped taking medicine sophomore year of high school. So, was that 8 years, 9 years?
Yeah. A large part of your youth was, not controlled by the diagnosis, but the diagnosis certainly affected your childhood. And I'm sure, as if you want to detail it, during those formative years, there was a lot of developments in terms of pharmaceuticals and what people use to treat ADHD. So did you jump around different medications while you were a kid?
So for the most part, I was on Adderall. I believe my parents sort of realized my sister, who's 6 years older than me, had lots of trouble in school. And we've always been very similar. So they sort of realized, hey, he's showing a lot of the same signs as her. So I got started a lot earlier than her. She didn't start taking medicine until she was in like 7th grade. But very different when you're, a little one.
Sure.
So I think I probably started off with 5-10 milligrams of Adderall every morning from like first grade. I'm going to say all the way through 9th grade, but, got incrementally larger doses as I got older and everything. The only real change up with that, I remember, don't ask me why I remember the name of the medication, but we switched to something called Strattera.
Okay. Yeah.
And I remember we were literally both, my sister and I switched over to that because it was a new alternative. Maybe it would work better.
Sure. Yeah.
and we were on it maybe a week before they took us back off because just violent mood swings. Like it was horrendous. Like I remember both of us just in tears over nothing and being exhausted. And that's probably 20 years ago, and it still sticks with me. Like that week of just hell.
Yeah, I won't dive too deep into it, but when you're a kid and you're experiencing those untoward effects of the medications, I know there's just like a not an immediate distrust, but you just don't want to take the medication anymore. You're like, what is this for? Why am I taking it? This is terrible. I don't want this anymore.
Oh, absolutely. I mean, I would say that's my only real distrust of medicine is my experience with it has really made me not want to take anything that, feels like it chemically alters my personality, the way I think, because I remember, especially through high school, because I was probably up to 60 milligrams, whatever, like the highest dosage is.
Do you feel like a lab rat, like a guinea pig when that happens? I would feel like I'm being experimented on. You know what I mean?
And that was a big part of why I still to this day don't think my parents know that I stopped taking it while I was still actively getting prescriptions of it. But, I mean, freshman year of high school was a disaster because, of course, hormones and all that other stuff,
puberty, all the fun things. Yeah.
Really wanting to break out and be your own person. And both between Adderall and just the sort of lack of understanding of, depression and spectrums of, autism, anything like that. Cause I know I would fall somewhere on the spectrum. But it was just a failing all around, both from both a medical standpoint and my teachers. Cause I remember my grades went way down, about halfway through freshman year. And when my parents went to parent teacher conferences, they were surprised to learn that my grades had fallen so much. And one of my teachers in particular made a comment that JR is the most depressed child I've ever met, were her exact words. But no word to the counselor, no connection. Maybe that's why your grades are slipping. And it just blows my mind. It really does.
Did your parents say, now wait a minute, maybe this isn't the answer? Maybe, the medications need to be changed, or maybe you just need to come off of them? Was there any open forum discussion about it?
I think they were honestly more focused on the grades at that point. I still, I think they are happily naive about some of how I am. Because there was a time where I was just manically depressed, and they would have had no idea, because on the surface with them and with friends, I'm same happy, outgoing guy I am. And
I know everybody's different, but as a ninth grade boy, I certainly wasn't willing to come forward with open feelings and secrets, and I would just kind of bottle things up, and I think that's totally relatable.
That's me to a T. Like, just bottle stuff up. It shouldn't be other people's problems that I'm having a bad day. But yeah, I mean, that's
a tough time. Ninth grade is what, 13, 14 years old, something like that.
14,
15. 14, 15. Yeah. That's a really tough time to feel like a lab rat and to have all of those things going on. But moving past the ADHD and the medication debacle, the coma itself, do you remember what it is you were getting operated on?
I was actually getting my tonsils and adenoids removed. As my mom reminded me, I apparently had a lot of trouble sleeping as a kid. I think it was specifically that my tonsils were squished together. So I did not breathe well. I would snore and just awful tossing and turning when I slept because I couldn't breathe. So what should have been a very easy procedure turned into hell for my parents.
And I've never had my tonsils removed. My tonsils or adenoids removed, but from what I understand, it's pretty low risk. And typically, people go in with a positive attitude. So was this something you were scheduled? You were scheduled for surgery in a hospital,
Yes.
or was it like an outpatient surgery center? Do you remember?
No, it was definitely a hospital.
Yeah.
I think it was Warminster General, which is not a hospital anymore.
I gotcha. In Pennsylvania.
Yeah, yeah.
So what is the last thing you remember? Because I have been put under, quote unquote, once before to have my appendix removed, and the only thing I remember is counting backwards from 10 and then waking up later, and I didn't know how much time passed. I had no, lucid memories or dreams or anything like that. I just woke up and my mother was there bedside, and I was in a hospital in, I believe it was North Carolina. I was on vacation when my appendix burst.
Well, it's funny. Some of the memories that have really stuck with me when I'm talking with my parents, they couldn't peg down when it would have been. So I don't know if some of it is just, coma, adult, child memory, whatever.
Right.
But one of the most vivid ones that stuck with me feels a lot like alien abduction type thing. Like it was probably when I was getting put under. I remember either being on the table or, on the bed or whatever, but probably the table, they were probably putting me under. But
yeah,
my vision of the room in my head is just all black except for the immediate lighting on me and the people directly around me.
So it felt like a large spotlight, like a beam coming down from space. And everything. You know what? That's not completely crazy, because they definitely have some pretty bright lights in ORs. So I can see how you could remember that as an alien abduction situation. So everything was dark. You saw a giant beaming light down. Did they have you count backwards? That was like the one thing I remembered from when I had my appendix removed, is I remember counting backwards from 10 and not making it. I was out before I even made it to 10, or before I made it to 0. I'm sorry.
That doesn't stick with me as much. I mean, it's very possible, but the main thing that sticks with me that was like an ongoing thing for years was the little like pulse clip they have on your finger, lights up and everything, was just ET phone home was what my dad would do to make me laugh and everything. So I'm sure that ties even more in my head to the whole alien abduction.
Yeah. You know what? This is how you wanted to remember it. You were probably just binging alien movies or something like that. No, actually, that's not completely asinine to envision it as an alien abduction, because those lights are really bright, and when they're beaming right down into your eyes, and they're putting a mask over you, and everything in your peripheral vision is kind of out of focus. Yeah, I could definitely see that being remembered as an alien abduction. But did your parents ever have risks explained to them? Did they mention anything about, hey, we have to remove his tonsils, his adenoids, they're becoming a hassle for him, and they're impairing his ability to sleep. We think he should get this surgery, but you run the risk up to and including death. I imagine that's an across the board, any surgical procedure disclosure. But were any risks explained, like, hey, he might be in a coma?
No. I mean, that came out of nowhere. For all intents and purposes, completely normal, run-of-the-mill tonsil removal procedure. Actually, I mean, a lot of my mom's run-ins with medicine have just been doctors sort of dismissing symptoms or signs that something's wrong, and my mom insists, and they're like, no, you're just tired. Like, it's been a long day here with your son. And I think she expressed her concern once I came out of surgery, which apparently took longer than it normally should. Normally, I guess it's a probably 2-hour procedure, like fairly simple. But I think it was all of the day. Like, I probably went in 10 a.m., didn't get out till 6 p.m., something like that. But apparently I was just very dazed when they got me out of it. Like, I was there, but my mom said my eyes just got more and more glassy. And she mentioned it to the nurse, and the nurse like, oh, you're just tired. He is just tired. It's a long day. And my mom said, like, within the span before the nurse left the room, I was on the bed having a seizure so hard I almost bounced off of the bed. Like, I just faded. Yeah.
And I guess this is the moment they realized, hey, he's not just taking a while to wake up from the anesthesia. He's actually having issues. So how long were you, I'm guessing you were in a medically induced coma?
Well, it's funny because we don't know exactly what caused it. There's two theories. Either the people at Warminster General at the time gave me too much saline, because apparently I wasn't eating, taking fluids, anything after I came out of surgery. So one theory from the people I transferred to was they administered too much saline. The other is that I'm sensitive to anesthetic.
Right.
So it's kind of scary to be moving forward with my life now, knowing that, hey, this could happen again if I had another major surgery. Like, how do I not know what caused this?
It's good that you have the memory, and you should keep it with you, because moving forward, if you do ever have a scheduled surgery, you should always disclose, hey, I might have had a really bad reaction to anesthetics in the past. Here's what happened. I would definitely include that on your relevant medical information when you fill out forms and whatnot, because that can allow them to adjust what it is they administer to you. So how long were you in the coma for?
I believe about a week. Say my appointment for the initial surgery was Friday. I don't think I came to and went home until the following Thursday. So yeah, long, stressful week for my parents.
Yeah, that's traumatizing. Not only as a child, as a small child, maybe it didn't affect you as much. Then I'm trying to remember those years in my personal life. I don't know if it would affect me as much as it would affect my parents, because it seems like a completely traumatic experience for them. So they were with you for an entire week in the hospital, just waiting for you to wake up. And when you finally did wake up, do you remember seeing anything, thinking anything, just being like, oh, that was a great nap? Or how did that work?
Oh, I mean, just like the, ET finger clip. It's these little, very specific things that stick with me. It's not the, oh yeah, what day is it? Who's president? Like,
yeah.
It's, I remember, that was how I got the start of my Beanie Baby collection, because all my relatives are visiting and leaving stuffed animals and, just revolving door of relatives. But apparently, like, before I completely came to, there were like 2 days. Let's say, I went into surgery Friday. By the following Wednesday, I was waking up in short stints. My mom would read me a bit of a book, and then I'd be back out. And then I'd wake up again, and she's like, hey, do you remember any of, that book? And I wouldn't. It was just completely separate episodes. And the really scary thing, apparently the doctors told my parents, like, this might be as good as it gets. This might be him for the rest of his life.
Oh, no.
Which, that's horrifying to hear. I had no idea. Like, found out 2 weeks ago when I was making this call and prep for this. Like, just, like a very special episode of a sitcom or something. Just character who wakes up, goes back to sleep, wakes up, doesn't remember anything. Like 51st dates. Like,
yeah, that's horrifying to be told, hey, your very small child who has a very long life ahead of him might be bed confined with, severe memory loss and all sorts of cognitive deficits moving forward. That would definitely rattle me a bit. When you got a little bit older, or maybe even at the time, did anybody really explain to you what happened? Or like, did they go in depth and say, hey, here's what happened, here's why it happened? Or did you just chalk it up to a neat little alien abduction vacation? Or
yeah, I mean, neat little alien abduction vacation where I remember, going into it. And I'm sure it was the first thing I mentioned when coming out was I was promised ice cream and bubble gum after the surgery. Because, like, especially growing up, wasn't allowed to have gum. So was so excited about that. And, my mom said when I came to, like, it was like nothing happened. I didn't remember the coma. I didn't remember just, hey. And I was probably released the same day I woke up.
Wow.
which is crazy.
Did they, when you got a little bit older, did they ever mention this to you or like explain it to you or use it as reason to explain maybe issues you were having or anything like that?
Honestly, I don't know why I haven't known more about this.
Right.
If I'm just uninterested, it was like, oh, that's in the past. That it really hasn't impacted my life in any major way other than, small visits to the doctor. I'm like, oh, I might have adverse reaction to anesthesia, but
For sure. I mean, luckily you did wake up and, there were no adverse events moving forward. But when yeah, I'm sorry, go ahead.
I was going to say, that was a funny question I had from my parents was like, I know I'm young, your personality is not fully developed to you, but I'm like, was I different when I came out versus I went in? Because I'm like, that would be so strange here. It's like, oh yeah, no, completely different kid came out of it. Just, but no, they insured me exactly the same person.
Yeah.
So,
did the doctors or nurses or your parents or anybody like that ever, or I should say, did the doctors or any of the specialists explain to your parents that they had a fear like, hey, you said this is as good as it'll get, but before you actually regained consciousness, did they ever say like, oh, he might not wake up?
Oh, absolutely. Yeah.
Yeah.
Apparently it was the week of my mom just obviously bedside whole time, dad's coming and going, but still going to work during the day. But yeah, it was absolutely a fear. He might never get up. And then it was, the in and out episodes. But I mean, it all just happened so fast from surgery to that. I mean, I was helicoptered from Warminster General over to, I believe it was St. Christopher's in North Philly.
Yeah, in North Philly. Yep.
But my parents said while I was under, because I was in the CICU, there were literally like open heart patients who came and went before I woke up. Like they came in after me, left before I came back up. So I mean, it was serious.
Yeah, for sure. Did that leave a bad taste in your parents' mouth at all? Because you mentioned that your mother was expressing concern and they were a little bit dismissive of her concern. Did that leave a bad taste in their mouth afterwards? Like, were they resentful towards the hospital, towards anybody?
I mean, my mom is just such a happy-go-lucky, put good into the universe type of person. And I mean, I asked them, I'm like, did you consider lawsuits? Like, was this malpractice?
Right.
And, their response was just, it was an accident. These things happen. No one intended for this to happen. Like,
right.
I definitely feel like she is still very trusting that doctors are inherently trying to do the best they can with the tools they're given, despite, a couple run-ins, between that. I think I mentioned to you even off mic, the day I was born, even like just dismissal of her medical needs. I know we had instance with my grandfather, and still she's very trusting that doctors are just trying to do the best they can with the tools they have.
Were there any permanent ailments or deficits or anything like that moving forward? I believe you said, you had ADHD and you don't know if there was any correlation between that and the event, the coma event. Do you know, were there any issues with motor skills or speech skills or anything like that?
Honestly, on a timeline, one of my few other medical things, I'd be curious now to know if it correlated, because I believe it was after the coma, but apparently when I got tired, like when I got really exhausted as a kid running around hyper old me, my right foot would turn inward and I would like trip over it to the extent where I had to go to the podiatrist. I actually had to wear a pair of sneakers when I slept with a bar screwed into the bottom of them to keep my feet pointed outwards from each other to sort of train my muscles to just make that the default position. Honestly, I'd be curious to know if that was a result of the coma, because I believe that was afterwards, like a year afterwards.
that came to my mind because I just think like, oh, that's a pretty serious, ailment to experience. And I find it hard to believe there wasn't some untoward effects, even just for a little bit afterwards. But again, like you said, it was tough to say. And your mother said, you came out the other side of the coma exactly as you entered it. So that's good news. I'm not wishing harm, but that is kind of interesting. I almost feel like it's hard to believe that somebody wouldn't be a little bit different. You know what I mean? It raises questions as I grow up, is this going to affect me? Is this, does this have anything to do with the, hurdles that I encountered as a child, as an adolescent? Absolutely. Yeah.
No, because I know I did have to go get an EKG. I'm going to say anything from a couple months to a year afterwards to make sure there wasn't any neurological stunting as a result, which I guess they gave the go-ahead that it was good.
That's good. All good news.
Definitely have to wonder because lots of times, especially the whole feeling like a rablet, it's like I feel like I think differently and like my personality is different from everyone else. And is that a result of this huge thing that happened when I was so young,
Yeah. Yeah. Did it affect, your development in those formative years? Moving forward as an adult, do you or you spoke to it a little bit with your mother, but do you have any fear of healthcare or hospitals or anything like that? Have you had any surgeries after this event?
Not really, no. I laugh so much of the time about how lucky I've been not needing to deal with healthcare that often. I mean, it's really just the medication through grade school. Never broken a bone, despite not taking great care of my teeth. Never needed anything large from a dental standpoint. Like, I have really lucked out, and my mom sort of laughs and says it's because you got the big stuff out of the way early. Like,
oh my gosh,
yeah.
There was a running joke between my mother and I that I was the person who always got injured on vacation. So anytime I traveled somewhere, I would get stitches or surgery. I go to North Carolina, I get my appendix out. I went to Australia, I needed stitches. I went to the beach in Maryland, I needed stitches. It felt like every time I went anywhere, I always required stitches or, an operation or something like that. But I really appreciate you coming on. I think everybody needs to, especially people who work in medicine, need to hear the patient's perspective or the patient's parents' perspective sometimes, because, being able to gain insight as to not only how you feel, but, even after all things are explained in layman's terms, how limited your knowledge can be, because you could say it 9 different times, but sometimes it's just difficult to comprehend. If you don't spend every day working in medicine, studying medicine, et cetera, how are you supposed to, come in and just completely comprehend everything that's being thrown at you, especially something as complex as a coma, a week-long coma as a kid?
I have one anecdote from my dad, which in hindsight, very funny, but also so sad. So he was, I guess, at work the day of the initial surgery, and was set to come visit once I was out, or I guess come pick up my mom and I. And I believe my sister was being babysat by our neighbors across the street. Right. And he got back from work, and Mr. Henry, our neighbor, came across the street, knocked, and said, "Get to the hospital now." And he said, he didn't know what was going on. And as he drove up, Eric Clapton's Tears from Heaven came on, and he was apparently just weeping in the car on his way up, fearing, the absolute
worst song to come on.
Oh, and yeah, he apparently didn't see me at Warminster General. They had to practically chase the helicopter to come see me at St. Christopher's. So he's just fearing the absolute worst. So,
this is pre cell phone, or maybe pre.
Oh yeah,
cell phones being popular, so means of communication, if he's commuting home from work, is non-existent. There's unless he had a car phone in one of those old Mercedes or something. You know what I mean? Unless he had that, there's no way for him to be reached in the interim.
If I was sick, it was 1999. So yeah, definitely pre-cell phone.
Yeah, that is horrifying, and I think a lot of people gain value out of hearing your story and the perspective that you and your parents have to offer. So thank them for me, And
Absolutely.
thank you for being on. Any final words that you'd like to offer?
No, I mean, just thank you for having me. It's been a pleasure. I'm happy to share my, weird, unique experience, as little as I remember about it.
Thank you for coming on.
Absolutely.
I'm going to stop recording now.